One thing to know about Stan Pauley is if you called him up and said, hey, we're going to be in U.S. News and World Report for the first time, his response was, what are you doing next? It was always, where are you going forward? And it was that spirit that I think was really important for a whole cadre of people over the years who were very anxious to make things better for patients. You know, when you talk about developing a heart center, the people and ideas and the energy were here to create new opportunities for teaching, research, and advanced patient care.
We repositioned it.
One of the greatest contributors to cardiovascular medicine is Dr. Ken Ellenbogen for bringing in electrophysiology procedures and ablations. His innovations are translated worldwide.
But he goes beyond his published books, his leading research grants. I think the most compelling things he's done is how he has touched and impacted patients and trainees.
Dr. Vetrovic and Dr. Ellenbogen trained me. The biggest thing that I took from each one of them is dedication to their craft. Dr. Vetrovic is the leader in interventional cardiology. I remember being a fellow and seeing Dr. Vetrovic in the CICU at 11 o'clock at night and being like, why are you here? He's like, well, you're here, I'm gonna be here.
His work ethic is unmatched. His dedication is what we all try to live up to. And he really deserves credit for the Heart Center and what it is today.
I remember one of the faculty members coming to me and saying, you know, Vetrovic, you've got a really great first team, but you don't have a bench. We wanted to be able to recruit more interested, invigorated people to carry forward this.
The gift from the Pauley family can easily be described as transformational. Identifying a center unifies the faculty and allows us to leverage that unity in an outward presence. Over the last 20 years, we've created an environment where we've had a high concentration of clinical talent and research success, and we've been able to nurture and grow high-end clinical care delivery.
We are so fortunate to have one of the premier cardiovascular surgeons in the world, and that's Vig Kasarajan.
I came to VCU because of Dr. Kasarajan. I was urged by my mentors that this is someone that would push the boundaries of what other surgeons would do, trying to help patients, often who had no other options.
And Vig is a collaborator. He's a natural innovator.
Now we have heart failure faculty in excess of 7 or 8 cardiologists, where we had 1 or 2 20 years ago, and we continue to grow.
We were able to continue to advance cardiovascular health in all of the fields, like cardiac imaging. Dr. Hunley came at a time where we didn't have cardiac MRI, but we really needed cardiac MRI, and so he really stood up this program, which has totally grown, and I've been able to see him be this visionary.
He has a knack for listening to people and developing programs that are impactful, like training people like technicians and perfusionists. It includes improving access pathways. We've grown in places like Williamsburg, Tappahannock, and Fredericksburg. I think all of this has culminated in many, many impactful projects here today as we talk about the Pauley Pavilion.
To be able to see the patient, have all the testing at the same time, so that in one visit to one location, your disease process can be addressed. And that's going to be very unique in the city of Richmond. And then also to integrate our education, our research, and our community engagement missions under one roof, so members of the community can be actively involved in shaping how to deliver pragmatic solutions that will work in the environments with which they live so that cardiovascular disease can be addressed in the community.
Having this expertise, having these resources side by side so ideas can develop, so innovation can occur. This is the essence of having the Pauley Heart Center.
I think Mr. and Mrs. Pauley, their vision was to see it grow and be better. And I think it is, and I think they would be proud of that.
And I think this happened with years of sweat equity, much of this with the leaders we've talked about here, the faculty over generations.
And incredible support staff from nurses, technologists, social workers, and other medical specialties that make this possible.
The patient is at the heart of everything that we do. I think it is so important to celebrate the 20th anniversary of the donation because it really helped catapult what we do so that we are on the cutting edge of patient care.